the skyway there's a rainbow highway to be found, leading from your window pane to a place behind the sun, just a step beyond the rain. Somewhere over the rainbow, way up high, there's a land I've heard of once in a lullaby. Somewhere over the rainbow, skies are blue, and the dreams that you dare to dream really do come true. Someday I'll wish upon a star and look up where the clouds are far behind me, where troubles melt like broken glass, where above the chimney tops, and where you'll find me. Somewhere over the rainbow, bluebirds fly, birds fly over the rainbow, while I can't hide. If happy little bluebirds fly beyond the rainbow, why I can't Good afternoon, everyone, and welcome to our virtual celebration of graduates from the College of Health and Human Services at George Mason University. It is our distinct pleasure to have our graduates, family, friends, and other faculty and staff from the college with us this afternoon. As you know, this year has been a little different in a number of ways. And we had the pleasure yesterday and earlier today of celebrating our graduates in person. And earlier in the week, there were some other university-wide celebrations. But for those of us, or those of our graduates who may not have been able to come to those ceremonies, we wanted to make sure that we took the opportunity to let them know how proud we are of their accomplishments and to just have another opportunity to recognize all that our students have done during their time at Mason. So my name is Kim Holmes, and I am the Associate Dean for Student Affairs in the college. And I am joined by a number of my colleagues, including the dean, department chairs, and some other folks who are helping support in the chats and comment sections on YouTube. And we welcome you to post on social media. And at the end of this event, we're going to share some links to our pages online if you want to continue to engage or see the individual graduate slides. So the order of ceremony is posted on the screen now. And so we're going to start with some remarks from our Dean, Jermaine Lewis. And then I'm going to introduce each department chair, and they will call the PhD or DNP or other doctoral graduates by name and with their dissertation titles. And then after that, we will scroll through all of the other graduates for the other degree programs. And then we also have the departmental award recipients. So typically we would have an in-person celebration for our award winners. this year we will be mailing those awards to you, but we just once again want to recognize the accomplishments and the hard work that all of our students have done. So with that, I will pause to turn it over to our Dean, Dr. Jermaine Lewis.
Thank you, Kim, and welcome family, friends, and graduates of the College of Health and Human Services at George Mason University. I don't know if many of you had a chance to participate in earlier events, but I'm assuming that many of you have not. So this is another ceremony to recognize all the work of our graduates and to celebrate their achievements. I'd like to take just a few minutes to recognize some of the accomplishments of our students. Graduation is a culmination of years of hard work, effort, and time spent in earning a degree in education. Just remember, an education is not for sale, it has to be earned, and it can never be taken from you. It is a lifelong gift you give yourself. We celebrate each of our graduates' accomplishments and ask that you continue to use your education to have a positive impact in and for the world. Remember, information is power, so use it well. This past year, as Kim suggested, and we all know, was anything but typical. Each of you has taken classes in some combination of maybe face-to-face, hybrid, virtual instruction, and you still came out on top. You've completed not only coursework, but internships, practicums, fields, and clinicals to ensure you have the skills, competencies, and expertise your discipline demands of you. Your ability to successfully meet all of the academic demands in the context of forces well beyond your control is witness to all you can do in the future, and it is a part of your living legacy of what is possible. To our parents, siblings, partners, spouses, family members, and friends, thank you for all the support you've given our graduates to reach this day. And I also want to thank our faculty, advisors, and staff for all their work throughout this year. They too had to deal with the pandemic. Moving forward, let's all work together to help rebuild our communities. Irrespective of the degree that you've earned, all of the health degrees represented in the college are very much needed in rebuilding future communities and society. I ask you to join us in delivering health for all to support health equity. Each of you has the knowledge and the ability to improve our communities, and I ask that you work to support a world with health, not disparities, with safety and not violence, and with prosperity, not poverty. Continue to make Mason proud and know that you always have a home at Mason and here in the college. And as alumni, you will be able to come back and participate for real in all types of celebrations. So I look forward to meeting you all in the near future. Congratulations to our graduates and congratulations to family and friends. Thank you.
Thank you, Dean Lewis. So next we will have the chair of the Department of Global and Community Health, Dr. Carrie Drews-Botch.
Thank you. Welcome. Technical difficulties. Isn't that the thing, the word of the year? So first of all, I want to congratulate everybody for all the hard work that they've done and the achievements. In GCH, the Global and Community Health, we don't have any PhD graduates yet since we just started our PhD program in public health, but it's an exciting time in Global and Community Health with the inaugural class starting in January. Just briefly, I'm Carrie Drews-Botch, Chair of the Department of Global and Community Health, and I want to congratulate all the graduates this year who completed their studies in the midst of really trying circumstances. We are fortunate to have been able to gather in some ways for this commencement, but this is not your usual graduation ceremony. And as has been true for more than a year, things are different and new traditions are replacing the old. Similarly, you have completed your studies in novel ways. It's not easy to juggle school, life, and work in regular times, and to do so during a global pandemic shows your resilience and your determination. You and your loved ones should be so proud of all that you have accomplished during your time at Mason. But I specifically want to send my congratulations to the graduates of the programs in the Department of Global and Community Health. 14 students who are receiving their certificates in public health, the student who's receiving her master's in science and global health, the 42 students completing their Master of Public Health degree, and the 132 students completing their Bachelor of Science in Community Health. Well done to all of you. Together, we are adding nearly 200 trained public health professionals to the workforce. The importance of this workforce is strikingly apparent now more than ever. Most of you entered your studies before epidemiology and public health measures were heard now hourly on the 24-hour news channels, and before public health professionals were heroes in the fight against the tiniest of foes. You couldn't ask for a more interesting time or a more vital time to enter the field of public health. But I want to be sure that I don't neglect the work of public health in impacting other important health concerns, including the substantial impact of race and socioeconomic status on the health of our citizens. Unlike some of the other degrees represented here, you will not be able to see the impact of your work on individual patients and clients. In fact, public health is often undervalued because it is inherently concerned with the health of the population rather than individuals, and often invisible because it prevents rather than cures disease. That said, the work that you do will have enormous and broad impact on the health of all members of our community. To paraphrase Earl W. Stafford, you have chosen to dedicate your lives to doing good for others. So in closing, I wish you much future success in your endeavors, and I look forward to the time in the not so distant future where we can safely gather together and celebrate your accomplishments in person. Thank you so much.
Thank you, Carrie. Next up, we have Dr. PJ Maddox from the Department of Health Administration and Policy.
Greetings, graduates and family of the Department of Health Administration and Policy, including programs in health administration, health policy, and health informatics. On behalf of the faculty, 20 strong, and our terrific administrative staff, we want to be the first to congratulate you for prevailing at a time when pursuing graduate and undergraduate degrees while also coping with life has been more than difficult. We are very proud of your efforts to prevail, and we are very proud of the work that you've done here in your final year in your studies. It's been a year marked by special occasions associated with completing practicum programs, faculty participating in, along with students, competitions for strategic management and planning involving teams that have been finalists and even national winners. It's been a year where dissertations have been completed and where countless of our students have also engaged in many challenging exercises, bringing community benefit and, more importantly, enhancing and enriching their future careers as part of their transition from full-time students to full-time leaders in the health industry. So for those of you that are going on to exciting careers, often in the background, managing and leading health systems, developing programs that manage and offer evidence and science for the decision support in healthcare, and those who are supporting health policy, we want to give our very best congratulations. Please stay in touch. We look forward sincerely to all that you do in the future. Congratulations to the graduates of the Department of Health Administration and Policy.
Thank you, Dr. Maddox. Next, we will have Dr. Marty Kubik from the School of Nursing.
Thank you, Dr. Holmes. Welcome, everyone, to this lovely afternoon in front of our computers once again. Someday soon, we'll close the laptop and walk away outside and enjoy the warm summer weather. It's my pleasure to congratulate all the College of Health and Human Service graduates, but a special congratulations to those in the School of Nursing. Our graduates of our Bachelor's of Science in Nursing program, our Master's of Science in Nursing program, our Postmaster's program, our Doctorate of Nursing Practice, our DNP students, as well as our PhD. You all stepped up this year in the classroom. You stepped up in the hospital. You stepped up in the clinic, and you stepped up in a big way, serving the community here on campus, as well as in surrounding counties, to fight the pandemic, to vaccinate, to support people as they took on the challenges that the pandemic has presented to all of us. We want to applaud and acknowledge your success today. We want to especially call out the effort, your flexibility, your persistence, and your resilience. It saw you through this past year to this point today, and it will go with you as you step forward in your career. So congratulations to the graduates of the School of Nursing. We're very proud of you. I'd like to acknowledge the Doctorate of Nursing Practice graduates, Kusham Aram, reducing non-emergent emergency room visits by using an evidence-based toolkit for emergency room nurses. Dr. Kristen Jennifer Ahern, her scholarly project was entitled Implementation of a Second Stage Management Protocol in George Washington University Hospital Labor and Delivery. Kate Asidu, Mental Health in the African Immigrant Community, collaborating with faith leaders to reduce stigma and improve access to mental health care. Cynthia Wadzi, Early Pregnancy Detection in Women of Childbearing Age with Substance Use Disorder. Sarah Javine Bott, Decreasing Out-of-Pocket Costs to Encourage Influenza Vaccine Uptake in a Free Clinic. Jennifer Lynn Briesman, Enhancing Provider Knowledge Through the Perspectives in Transgender Care Webinar and Provider Toolkit. Kristen Marie Clemens, Behavioral Health Transitional Care, Bridging the Gap Between Acute Care to Outpatient Treatment. Erica Nicole Edge, A Practice Guide, Overcoming a Pitfall of Defeat in Entrepreneurs. Alexander Alibo, Mental Health in the African Immigrant Community, collaborating with faith leaders to reduce stigma and improve access to mental health care. Nora El Nahas, Creating a Sustainable System of Support for Families Affected by Opioid Disorder. Alexa Michelle Gallagher, Utilizing Community Health Worker Learning Modules to Increase Preventive Services during the COVID-19 Pandemic. Anu Jasmine George, Anaphylaxis Management, a targeted approach to improve the epinephrine autoinjector access and use among primary care providers. Karniba Yohi Gonaim, Improving Postpartum Depression Screening and Treatment Referral by Pediatric Providers. Lauren Elizabeth Hoover, Because of You, Reshaping Providers' Attitude and Responses to Intimate Partner Violence Survivors. Elizabeth Reed Horst, Navigating the Integration of Office-Based Opioid Treatment into Primary Care. Kenya Jenkins, Muse, Any News? A program evaluation to address the gap from knowledge acquisition to application in practice. Janice Jungi Kim, Improving Awareness of Palliative and Hospice Care among Korean Americans with Dementia. Ellen Kodua Agbo, Bridging the Gap, Effective Counseling of Mental Health Patients to Enable Tobacco Cessation. Catherine Melanie Lancaster, Who Provides Support When the Nurses Are on Their Own, Implementing a Virtual Community of Practice for Virginia School Nurses. Tesfa Jimberu Mekonnen, Telehealth, a Means to Improve Sexual and Reproductive Health Services. Lindsay Najum, Expanding Provider Knowledge to Prevent Mortality in Patients with Eating Disorders. Ashley Nguyen, PrEP, Your Patient to Prevent HIV. PrEP Provider Education to Increase Uptake of PrEP among high-risk populations. Josephine Omari Yaboa, Improving Cultural Competency among Behavioral Health Professionals. Lorraine Andrasik, Evaluation of a Catholic-Based Recovery Program. Felicia Tanner Penn, Implementation of Nursing Education Modules, Intervention to Decrease Pharmacologic Treatment and Improve Inpatient Outcomes for Neonatal Abstinence Syndrome, using the Eat, Sleep, and Console approach. Kayla Potter, Routine Screening of NICU Parents using the PSS NICU. Carla Karim Reynoso, addressing cardiac risk factors among the Hispanic community by promoting health literacy. Sunisha Devi Sood Saha, the art of mentorship, educating emerging leaders in nursing. Soledad Soto Perufino, improving diabetes knowledge and care in the Hispanic Latino population via a culturally tailored educational intervention. Melissa Ann Swenson, improving underserved patients' access to mental health care through academic community partnerships. Jenny Tran, the evaluation of telehealth shelter-based care during COVID-19. Priscilla Ruth Switzer Trewatha, clinician-technician onboarding at Inova Fair Oaks Hospital. Karen Webb, nurse leaders' perspectives of the ED pediatric readiness, a priorities implementation roadmap. Katrina Patrice White, evaluation of readiness in primary care practice fighting the opioid epidemic. Michelle Whitaker, prior authorization in addiction medicine. Doctor of Philosophy and Nursing degree. Nesby Sumeye Kureyaleonglu. Sorry, Nesby. Implementation and practice barriers of family-centered care encountered by neonatal nurses. Abdullah Salim Musaba Al-Maroki, patient-centered care and self-management of type 2 diabetes in Oman, a mixed method study. Mary Curry Narayan, culture-sensitive, patient-centered assessment and care planning in home health nursing.
All right. Thank you, Dr. Kubik. We're going to now move into Dr. Larry Cheskin, the chair of the Department of Nutrition and Food Studies.
Thank you very much. And welcome to everyone who is graduating and all the people who have supported them in this Herculean effort. And I say Herculean because this is truly unprecedented, as you've heard from some of the other speakers, what we've gone through in the past year. And it is a credit to our students that they were able to overcome the challenges that we have been facing. And nutrition is an interesting aspect of the pandemic because many people, and I guess it's a joke, talk about the COVID-15 because many people have gained, they often say 15 pounds during the pandemic, and the isolation and other factors that we've experienced and less ability to be physically active perhaps has contributed to weight gain for many people. And this is something that we're studying and that is of great interest. I can say that the Nutrition and Food Studies graduates and award recipients will be well equipped to help people deal with both the medical and nutritional consequences of COVID-19. So my heartfelt congratulations to everyone who made it through this most trying of times, and I look forward to hearing your successes out in the real world. Thank you.
Thank you, Dr. Cheskin. We're now going to move to Dr. Rose Higgins, the chair of Rehabilitation Science.
Hi, welcome to the spring 2021 graduation. If we can go to the next slide, what I'd like to do is introduce our one Doctor of Philosophy in Rehab Science first. I'd like to congratulate now Dr. Andrew Eric Peckstein for his project on fatigability and cardiorespiratory fitness during sustained walking following overground locomotor training in individuals with Parkinson's disease. And he was mentored by Dr. Andrew Guccione. For the last 15 months, we have faced this COVID pandemic. I really want to congratulate both the graduate as well as the undergraduate students in rehabilitation science. Oftentimes, we learn more from people who push us hard and from difficult times and failures than we do from our successes. I'm sure everyone in rehab science this year has experienced that. The pandemic has also magnified our needs for social connections. We've also seen, as a result of the pandemic, a growing need for rehabilitation science in the COVID long haulers. I really want to let you know that you're armed with your degree and you are resilient, as many of the other chairs have commented on. And I want to congratulate the graduates, the parents, their significant others, family members, and the support they've received through the community this year. I'd also like to congratulate our award winners in the department. As you go forward, remember, aim high, and welcome now to the Mason alumni community. Thank you and congratulations.
Thank you, Dr. Higgins. Next, we will have Dr. Emily Ihara, chair of the Department of Social Work.
Thank you, Dr. Holmes. On behalf of all of the faculty and staff of the Department of Social Work, I'm so honored to wish all of our 81 MSW and 50 BSW graduates and all of our CHHS graduates our very best wishes as you embark upon your next steps of this lifelong journey. Today, we are here to celebrate all of your hard work, your diligence, and dedication to social work. And it is no surprise to me that you've all made it through this challenging time with grace and resilience. After all, social workers are very good at adapting to adverse circumstances. And we are all celebrating you today, your professors, your advisors, your mentors, your family members, and your friends. We all applaud you for your perseverance to make it to this point during a very challenging time in our history. And we are so pleased to welcome you as colleagues to our profession. I was so happy to see some of our graduates at yesterday's mini celebration with your beautifully decorated caps, first generation sashes, your honor cords, and the proud smiles of your families and friends. Social workers make a difference every day in the lives of individuals, their families, our communities, and society as a whole. We are at a point of time in our history where you are needed now more than ever. Social workers face complexity and uncertainty in much of the work that we do. The issues that we see on a daily basis don't often have easy answers, and they are intertwined and interdependent with so many other issues and systems. So as you begin this next step on your career path, I hope you will embrace our profession's core values: service, social justice, dignity and worth of the person, the importance of human relationships, integrity, and competence. Staying true to these core values will always serve as your guidepost. We often encounter very intractable issues in our society, and these things will help you as you move forward throughout your career. So there are 3 things I'd like you to remember to always pay attention to. First, it's not over. Your learning is not over. Every situation has a learning opportunity. As lifelong learners, I'm confident that you will approach every situation with the determination and diligence with which you mastered your degree in social work. I know that you will continue to grow your skills and abilities, apply creative and critical thinking, and rely on everything you learned about working in groups to collaborate to find the path to a solution. Number 2, keep your tools primed and ready to go. In social work, you are your best tool, and you know we talk about self-care all the time. Don't forget to take care of yourself so that you can take care of those complex and intractable issues alongside our clients. And third, be an inspiration for others. I know that many of you have found mentors throughout your life, and I hope that you should serve to be an inspiration for all of your colleagues and those future social workers coming behind you. Congratulations, everyone.
Thank you, Dr. Ihara. So with that, we have now covered all of our graduates and all of our award recipients. And once again, we just want to say how proud we are of you for all that you've accomplished, both inside and outside of the classroom during these most challenging times. We wish you the best in all your future endeavors. And I want to particularly encourage you to keep in touch with us. We ask that you think about opportunities and engage in opportunities to help other students as they figure things out, as they go through Mason, and as they think about their next steps past that. We encourage you to volunteer, mentor, come back for events, follow us on social media so you know what's going on in the college. Let us know when you have milestones or accomplishments so that we can keep in contact. I also want to just give a big thank you to family, friends who have supported you through this process, the faculty, staff, advisors who have helped guide our graduates to this point. And I want to give a special thank you to the planning committee for the graduation events this year, who have really put in a lot of time and effort to make sure that we had a number of ways for graduates to engage and be recognized during this time. Next on the screen, you're going to see a couple of links, and you should also see them in the comments on YouTube or in the chat box in the Zoom link, but we encourage you to go to those links to continue to engage with us and to see more graduation content. So all of the graduates were invited to create individual slides. There are videos from faculty and staff and from the department chairs in our college. So you can go there to see those well wishes from them. There is some interactive content where you can decorate a virtual cap. So please do go there to engage. This video, as well as the other graduation events from the university, are going to be posted on YouTube. This one will be on our college YouTube page, and the others will be on the university's YouTube page. So with that, Congratulations once again. We are so very proud of all of our graduates and looking forward to all that is to come for you. So many thanks for joining us today, and we hope to see you again very soon. Thank you.